the cardiac cycle into 3 simple steps. If you understand these 3 steps, then you've understood everything, including the heart sounds. These 3 stages are ventricular and atrial diastole, also known as the complete cardiac diastole. We have the atrial systole and the ventricular systole. The atrial and the ventricular diastole. When you hear diastole, it refers to resting or relaxing. This stage is where everything begins. It is also called the complete cardiac diastole. At this stage, the whole heart is resting. The atria and the ventricles, they are resting. They are not doing any work. The atrioventricular valves are open, and also blood just flows in. So blood flows in from the superior and inferior vena cava into the right atrium and down into the right ventricle. The heart is not doing any work. The blood is just flowing in. And that is why we say it's a passive feeling. It's a passive feeling because the heart is not doing any work. The blood is just flowing in into the ventricles because the AV valve is open. Same thing on the atrial systole. In this phase, systole refers to contraction. Atria is the plural of atrium, which is about the 2 atrium. So this talks about the contraction of the atria. In this phase, the remaining 20% of blood, the atria, actively contracts to pump the blood into the ventricles. So the AV valves are still open because they have to be open so that the blood can flow in from the atria into the ventricles. The ventricles are still relaxed because before the ventricles will contract, the atria